Med-Ed Bites, Micro Just-in-Time Education. Hi, this is Scott, and I'm here to guide you through this Med-Ed Bite. This study by Taboada et al. Investigated whether universal utilization of the McGRATH MAC video laryngoscope in all adult surgical patients would improve the ease of intubation compared to macintosh direct larygoscopy. The publication, titled Universal Video Laryngoscopy for Tracheal Intubation in the Operating Theater, a prospective non-randomized clinical trial, was published in Anesthesia in 2025. The trial, which was conducted at 8 hospitals in northwest Spain, was a prospective before-after study design consisting of 2 consecutive phases. A pre-intervention phase, where macintosh direct laryngoscopy was the first option for intubation, and an intervention phase where McGrath MAC video laryngoscopy was the first option for intubation. The trial participants consisted of consecutive adult surgical patients who required tracheal intubation. Intubations were performed by 1 anesthetist among 35 anesthesia attendings or 60 anesthesia residents. The primary endpoint was the percentage of intubations categorized as easy, defined as successful first attempt, a modified Cormack-Lehane grade of 1 or 2A, and no need for adjuvant airway devices. Additional endpoints included first attempt success rate, laryngoscopic vision quality, number of patients requiring adjunct airway devices, anesthetist graded difficulty of tracheal intubation, and number of complications during tracheal intubation. 5,135 patients were included in the study, 2,568 during the pre-intervention phase and 2,567 during the intervention phase. The easy intubation rate of 86.3% in the intervention phase with VL was significantly higher than the 74.3% in the pre-intervention phase with DL. Among intubations performed by residents, the intervention phase had an easy intubation rate of 83.1%, compared with 69.3% in the pre-intervention phase. First attempt success rate was also higher with the McGrath MAC VL, 91.6% versus 85.8% with DL. Difficult laryngoscopy occurred less frequently with VL in 7.2% of patients compared to 17.2% of patients with DL. The use of McGrath MAC VL was also associated with less need for adjunct airway devices and external laryngeal manipulation compared to DL. Likewise, patients receiving VL had fewer complications, lower rates of esophageal intubation, and required a change in operator less frequently. The authors conclude that, in a real-world operating theater setting, universal video laryngoscopy for tracheal intubation was effective in increasing the proportion of patients with easy tracheal intubation and reducing the incidence of difficult laryngoscopy and related complications compared with direct laryngoscopy. Medtronic, engineering the extraordinary.